So we were hoping to see positive results from the gemcitabine nab-paclitaxel to expand those advantages to the patients who may not be eligible for FOLFIRINOX in the adjuvant setting. Study unfortunately was negative. Now it's interesting, although it's negative, it's a little bit confusing. It's still negative, but it's confusing. The disease-free survival goal was met on the top line or close to. It was 19 months, which is very similar to what you see with FOLFIRINOX. The surprising factor was gemcitabine. It was close to 18 months, whereby gemcitabine DFS is typically 12 months from what we know from other studies, including the PRODIGE. So what could be the difference? One is its selection of patients, possibly, but you would argue that with FOLFIRINOX you're also selecting the patients similarly. The other possibility is this was a centrally reviewed primary endpoint, meaning the scans were reviewed centrally rather than by investigators. And when they actually looked at the investigator assessed disease-free survival, the gemcitabine was closer to where you expect it to be. Survival was interesting, was 40 plus months. It was about 50 plus months in the FOLFIRINOX study, but these are completely different studies, different selection and all that. So I think what could be drawn from this is, and it's actually close to statistical significance. So the survival actually with gemcitabine nab-paclitaxel may favor gemcitabine nab-paclitaxel.